Hi, I'm Suzanne and I'm one of the registered nurses here at Pacific Center for Plastic Surgery. I'm going to talk to you today about your post-operative instructions for a rhinoplasty. Let's start first with activity. After you've had your rhinoplasty, you're going to go home and rest. You need to sleep elevated on a couple of pillows, or even the first night it might be helpful to be in a recliner or in a couch and to use pillows. It's really important that you breathe through your mouth. You're not going to be able to breathe through your nose. Another point that helps with this, because you are breathing through your mouth, is to use a humidifier, which will help with your mouth getting really dry. We don't want you bending over. We do want you getting up and moving every couple hours and wiggling your toes. Positioning is really important during the recovery period of a rhinoplasty, and that is being elevated. And it's also really important to not swallow the blood. You can use a gauze or you can use a little spittoon or whatever you want, but as you feel drainage coming out, please spit that out, because that will contribute to you having nausea. And if you get nauseous and vomit, it's really uncomfortable because you're going to have more swelling and bruising. And we really want to minimize this and help you to have a speedy recovery. Ice packs are a really important part of your recovery. However, it's really important to not put them directly on the nose. What you can do is get some frozen peas and separate them in little baggies, and you can put those baggies around your face, just around under here, on your cheeks or under your eyes, but don't put them directly on your nose. Expect to have bruising and swelling under your eyes. That's very common after this procedure. The wound care after a rhinoplasty typically is to have a little gauze underneath your nose. Depending on what type of rhinoplasty, there's different types. There's open and there's closed. Depends on how much drainage and where the incisions are going to be. If you have a gauze underneath your nose, then you're going to have to keep replacing that probably for about a week after surgery. You can use gauze and you can tape, and you can just, it'll help catch some of that drainage under your nose. You can also clean that area with a little bit of hydrogen peroxide mixed with water and put a thin layer of bacitracin. Please don't, like we talked about before, don't swallow that drainage. Gently spit it out, because that will lead to having an upset stomach, which could lead to vomiting. During your post-operative time, you're going to be taking pain medication. We don't want you driving while you're taking any pain medication, because this does inhibit your ability to make good decisions. Let's talk about some of the common medications after surgery. And you'll start taking your antibiotics when you get home, and you'll take the remainder to the following day, in the morning and then in the evening. Next, we'll talk about your pain medication. This could be Norco, it could be Ultram, it could be Celebrex. It's important to take your pain medication as directed by the doctor, especially in the first 24-48 hours. After that, you can take the pain medication as needed. A common side effect to taking pain medication is constipation. That's why on your list of medications, we recommend that you purchase Colace. Colace is a natural stool softener that just helps soften that, because the Norco tends to cause constipation. Also, general anesthesia can kind of slow things down. So it's important, if you already have an issue of constipation, to take Colace on a regular basis so that you have regular bowel movements. Some other medications could be a clonidine patch, a scopolamine patch, and within those two patches, the clonidine is for blood pressure, and that's something that you would leave on for 5 days after your surgery. And another patch, which is a scopolamine, stays on for 3 days after your surgery, and that helps with nausea. When you do take that nausea patch off, please remember to wash your hands after you take that patch, because if you accidentally rub your eyes, you'll have blurry vision for up to 24 hours. Another common medication that we prescribe for you is Zofran, and Zofran is an anti-nausea medication. And that you can take every 12 hours, and that helps with, some people have an upset stomach to pain medication, some have an issue with anesthesia, but it does help kind of settle your tummy down. It's also important to eat some crackers or have some toast or something before you take your medications. You can shower 1 day after surgery, but please avoid getting your face wet in the shower. Your TED hose are something that we recommend that you have during your procedure. You can wear these up to 14 days. However, we do recommend that you start walking the first day after your procedure. If you're walking normally and not laying around a lot, you can take your TED hose off, but if you tend to lay around, we want you to wear these for up to 14 days. Your TED hose help with the circulation in your lower legs. And just another tip for you to remember, if you happen to fly on an airplane or sitting in the car for a long period of time, throw those TED hose on so they get multi-use out of them. You may feel a little dizzy and lightheaded, and you also may feel a little itchy. This is all very normal in the healing process. It's also normal to have bruising and swelling, and this can take up to 6 weeks for this to start to go down. If you get a fever 100.4 or above, you need to call the office. Also, which is very uncommon, you can watch for excessive bleeding or swelling. Anytime you have concern, please call the office and our staff will be happy to help you and ease your mind to let you know if there's any problems that you need to be concerned about.